Hey, I'm Nick.
Hey, I'm Chloe.
My name is Jude, and this project is our group project, and I had the main point one, and so that was our topic was over St. Jude's Research Cancer Hospital, and that was founded in 1960 in Memphis, Tennessee. The reason why they established this is because of obviously the ongoing amount of cancer patients that were starting to rise as the human rate as far as how many people being allowed rise. So like they needed to find more explanation to cures, and they needed to find more explanations for the treatment as far as what to do after they do the surgeries or whatever they're going to do to fix the cancer patients. So the three main points of the like St. Jude's Research Hospital, like why they established this, is to find the like cancer itself and then to cure it as far as the cancer, and then how to treat it afterwards. And so finding the cancer itself in the patient, there's three main ways that doctors use to do that, and those include physical examination, like feeling on the body, seeing anything, and then they have laboratory testing where they'll take samples of your body, as like your blood or your skin, or however they're going to do it. They'll take the samples of your body, send it in, and they'll have it laboratory tested. And then they have biopsy if those two options don't work. And that'll pretty much tell them exactly where it's at, because it's like a x-ray over the whole body. And so those three ways are how the doctors find the cancer in patients. The cure for cancer is kind of like a per se, like it's not really a thing. So like there's no one thing that's going to cure it all of a sudden. So like cancer itself is a disease where some of the body cells that are normal turn into abnormal cells and just start spreading and growing all across different body parts where they're not from. So like it starts from a gene mutation that like turns the cells from normal to a cancer cell, and the gene mutation can come from like being inherited, it could come from over time, or it could even just develop like if something happens to the regular normal genes, and it could just happen from that. And so there's a few like signs of cancer that are like pretty common, and it's like a change in your bowel, or like your pretty much the time you go to the restroom or whatever, like a change in that. Sores that don't heal. So like if you have sores anywhere on your body and they're just like not healing. Coughing is another one, like, or just having indigestion real bad, or having like a sore throat. Thickening or lumping, like lumps on your like your stomachs or like your breast or anything like that. And indigestion in a discreet way, like it's not just like regular like like that, like you're just having like a little bit, like it's in a really weird way where you're having a super sharp pain. And so curing cancer, like I said, is not really a one type thing you can do to cure it, but in a sense that's where treatment comes in. And this is where doctors will use radiation therapy, or like anything as far as medications go, or then they'll use chemotherapy to try to knock out some of the cancer cells that have grown to where they can bump it down and have a reverse effect on that. And so the three main treatments that doctors use to treat the cancer patients are radiation therapy, surgery slash chemotherapy, and surgery itself. And so for surgery, it's pretty simple. Doctors go in and they cut out the tissue where the cancer cells have been formed, and they hope that they don't regrow back. Now this process takes about 4 to 6 hours, and that's the surgery section. And then the chemo section is like they'll give you special medication that is supposed to shrink or kill the cells that have cancer on them, or the cancer cells. And these medications we cannot see as far, and the cells itself especially we can't see with our eyes. And this process takes about 3 to 6 months for that to fully alleviate your body. And then radiation therapy being the number one is pretty much radiation, like X-ray machines and stuff like that, that kill the cancer cells, and they go in and they try to slow the growth of it by damaging the DNA of it. And luckily, this form of therapy or treatment, it has little to no discomfort. That's why it's the number one chosen as far as that. But this whole process is kind of the most extravagant because it's 5 days a week and it's for 5 to 8 weeks itself. So radiation, chemotherapy, and surgery are all three treatments, or the three main treatments that doctors use nowadays to treat the patients that have cancer. Finding out you or a loved one has cancer, or even a friend or someone you may know has cancer, is a horrific event. No one wants to experience this, and no one wants to go through this, but thankfully technology has allowed doctors nowadays to find the ways to find the cancer itself, cure the cancer. Even though there's no one cure, they'll use the treatments to cure it, or to hope to cure it by killing the DNA in the cells to get rid of it entirely. And so this allows the treatment process to go smoothly most of the time. Now, sometimes the chemo or the radiation or the surgery doesn't necessarily work and it comes back and they have to either do it again or try a different route. But no one wants to have cancer. Cancer sucks.